For decades, Malaysia's healthcare system has been something to be proud of. It's achieved some incredible things. But today, that very same system is, well, it's at a breaking point. So what happens when a system that was built for yesterday's problems suddenly has to face today's challenges? We're going to dive into what's going on and what the plan is, all based on Malaysia's own health white paper.
All right, first, let's talk about the good news, because it's seriously great news. Just look at this timeline. Back in 1970, the average Malaysian lived to be about 63. Fast forward to today, and that number's jumped to almost 75. That is a huge success story, no doubt about it, built on decades of real progress in public health.
But that success brings up a really important question. We're definitely living longer, but are we living healthier? And this, right here, is where the story starts to get a lot more complicated.
And here's the answer, and it's pretty sobering. The average Malaysian can now expect to spend nearly a decade, 9.5 years, of their life in poor health. Think about that. We've added more years to our lives, but we haven't necessarily added more life to those years. This one number really gets to the heart of the challenge we're facing. So that brings us to the first big piece of the puzzle, the cracks that are starting to show. The whole system is just overstretched. It's overburdened. In a way, it's a victim of its own success, and it's now struggling with a whole bunch of new modern problems. So what's causing all this strain? You can pretty much think of it as a perfect storm. We've got these huge external pressures, like a massive rise in chronic diseases, new pandemic threats, and a population that's aging really fast. And at the same time, the system is cracking from the inside. Because people are paying so much out of their own pockets, the public and private systems are completely out of balance, and honestly, it's been underfunded for years. And if you want to know just how widespread this is, just look at this number. A staggering 98%, almost everyone, of Malaysian adults has at least one risk factor for chronic disease. This is not a small issue affecting a few people. It's a massive national health crisis hiding in plain sight. Let's just zoom in on one of those big risk factors, obesity. This chart says it all, really. Malaysia has the highest rate in all of Southeast Asia. That's not just a statistic, it's a huge visual red flag showing that we're facing a much deeper health challenge than many of our neighbors. So who's paying for all of this? Well, the government does cover the biggest chunk, sure. But look at that second slice. That's the hidden burden. Over a third of all healthcare costs are paid directly by you, the individual. That's actually one of the highest rates in the region, and it puts families in an impossible spot, forcing them to choose between their health and their savings. And you can see this financial strain playing out on the ground, in the clinics. The public sector, it has less than a third of the clinics, but is somehow handling almost 2/3 of all patients. Meanwhile, the private sector has most of the clinics, but sees way fewer people. This huge imbalance is exactly why you see those long waits and overworked staff in public hospitals and clinics. And really, what's underneath all of these problems is a core funding issue. Malaysia spends just over 4% of its GDP on health. But if you look at countries at a similar economic level, the average is over 7%. We're basically trying to meet 21st century health problems with an investment level that's been left behind. Okay, so pointing out all the problems is the first step, but now let's pivot and talk about the solutions. The Health White Paper lays out a new, really forward-thinking vision to completely transform the system. The absolute heart of this whole vision is a massive shift in thinking. For decades, our system has been what you'd call a sick care system. It's fantastic at treating you after you get sick. The big goal now is to move to a true healthcare system, one that's designed from the ground up to keep you healthy in the first place. And to make that happen, the white paper maps out 5 big goals. First, building a truly healthy nation that focuses on prevention. Second, creating a system that's equitable and person-centered, meaning it's fair for everybody. Third, making sure the system is resilient so it can handle the next crisis. Fourth, making it open and innovative, embracing technology. And finally, building a system that is truly valued by the people it's supposed to serve.
This quote right here really captures the whole new philosophy perfectly. All for health, health for all. And that's not just some catchy slogan. It's really a call for a huge shift where health stops being just the government's problem and becomes a shared responsibility for every single one of us.
Okay, so these are all big, high-level ideas. But what does any of this actually mean for you, for your family? when you just need to see a doctor. Let's break down how this could change your everyday life. So here's a simple side-by-side. Right now, you might face a trip to an overburdened hospital. The future vision? Getting quality care right in your own community. Instead of those high out-of-pocket costs, the goal is affordable services for everyone. The focus completely shifts from just treating sickness to actively preventing it. And instead of your medical records being scattered all over the place, imagine having one single, seamless digital health history.
Look, if there's just one thing you take away from all of this, let it be this. The main goal of all these reforms is to build a system that's designed to keep you healthy, not just one that waits around to treat you after you get sick. It's about being proactive, not just reactive.
At the end of the day, this isn't just some government plan. It's a national journey. The white paper calls for a whole-of-society approach, which really brings us to the final question we should all be asking ourselves. From our own lifestyle choices to how we support our local communities, what role are you gonna play in turning this vision for a healthier Malaysia into a reality?